Continuing on with our series of access to dental care, want to highlight some figures comparing Medicaid dental spend to the overall U.S. healthcare spend, and also highlight some figures that might be pulled forward if in fact we do cap or reduce Medicaid benefits next year. I think there's some figures in this article that are going to kind of jump off the page at you guys. So let's review. In 2023, combined federal and state Medicaid expenditures accounted for approximately 16% of the U.S. healthcare spend. So just north of 15%. Again, that's a pretty small piece of the overall pie, honestly, when you look at that. So while Medicaid covers a broad range of medical services, including hospital stays, physician visits, and long-term care, dental services are often more limited and vary by state. Specific data on Medicaid's dental spending relative to total U.S. healthcare are not readily available just because it is a federal program, but it's given out through the states. And as you guys know, the record keeping and data that the government has is not always the most accurate or up to date, which is a little scary in itself. But here are some insights that we can kind of extrapolate from data that we do know. So overall dental spending in 2023, dental services accounted for approximately 4% of the total U.S. healthcare spend, around $173 billion. Well, if we use that kind of deductive reasoning, given that Medicaid represented 16% of total healthcare spending, assuming dental follows a similar distribution, Medicaid's dental expenditures can be estimated around 16% of $173 billion. That leads you approximately to dental Medicaid benefits of about $28 billion for 2023. Keep that number in mind because we're going to review this again. This is going to come back at the end of the video. So, as we know, around $28 billion of Medicaid dental spend in 2023. So as we come on down here, and as we think about hearing that Medicaid benefits are going to get capped and or even reduced as we move forward and the government has to try and get the budget back in line, let's talk about some of the ramifications to the overall U.S. healthcare spend if we do in fact reduce those dental Medicaid benefits. The first thing that absolutely jumps off the page is an increase in emergency room costs. The ER costs are out of control. In 2020, so 5 years ago, and think about the inflation since then, dental conditions cost an estimated $2.1 billion, with 79% of those visits only being pain management. Again, there's normally not a dentist or oral surgeon on site in these ERs. All you're going to get is a script, and basically then they're going to tell you to schedule an appointment with your dentist. So that $2 billion is almost wasted. I mean, besides the script that you get, that nobody is actively going in there and removing the decay or addressing the underlying issue. They're just putting a Band-Aid on it, and a $2 billion Band-Aid is a big number. So obviously that $2 billion was spent while we had Medicaid dental benefits. You take that away, that number's gonna go a lot more north. Increased costs due to systemic health issues. Poor oral health is linked, and more studies come out by the day linked to heart disease, diabetes, respiratory infections, and even pregnancy complications. Studies suggest that every $1 spent on preventative dental care can save between $8 and $50 in future healthcare costs. That's incredible return on investment from a preventative standpoint. That's coming in, getting your cleanings, getting your exams, making sure if you do have decay, we can catch it as a filling before it has to be a root canal or an extraction. And if you have extractions and you don't put something into that socket, bone loss normally follows, and it's kind of a slippery slope from there. You also have untreated perio disease increases diabetes management costs by about 40%. So the overall healthcare spend is high on diabetes. We have a high percentage of diabetes here in this country, and untreated perio just makes that even more expensive and harder to control. And there's definitely going to be higher overall Medicaid and Medicare spending, primarily because this is an interesting fact. Many Medicaid recipients eventually transition to Medicare, which does not cover routine dental. So if you're just putting off these problems, eventually it's going to come home, and it's going to cost some money. A lack of preventative dental care in Medicaid populations could lead to higher Medicare costs in future due to worsening oral health conditions, no doubt. A study in 2021 actually estimated expanding dental coverage could reduce medical costs by over $63 billion over a decade, about $6 billion a year on average. That's pretty remarkable and the exact opposite of what we're currently talking about in the Indiana state and at the federal levels. So another thing that this is more of a soft cost, but it's absolutely real, an impact on the workforce and economy. Tooth loss and untreated dental issues reduce employability, leading to higher unemployment and disability claims. Poor oral health is one of the leading causes of lost workdays, reducing overall workforce productivity. 100%. Couldn't agree with that more. And this is where we're going to keep this number in mind from earlier in the study. If Medicaid dental benefits were removed, studies suggest that the healthcare system could incur an additional $10 to $20 billion per year. Remember, last year under deductive reasoning, total Medicaid dental benefits were $27 billion. So you can get rid of it, and at least $20 billion is going to move to the healthcare spend. So you didn't save any money. If anything, you've just put really expensive Band-Aids on things that eventually somebody's going to have to pay for. So again, really, really interesting stuff in this little blog. I will attach this video to the blog so you guys can read these numbers for yourselves, but just really, really interesting stuff. And I think hopefully some of the nuance is going to start to be brought to these conversations, because again, just cutting things doesn't necessarily mean that you're not spending. It just means you're not spending in that bucket, but somebody's going to have to pick up that bill. So comment down below, let me know what jumps off the page at you guys, and I'll catch you in the next video.